Some parents visit to my clinic claiming that certain food items doesn't suit their child. Now, what is that suit means? Either the child is allergic to the food item or not allergic. So let's discuss about this in this video. What a food allergy happens when certain food items which we ingest, body can react to that food item. The reaction can be mild or it can be severe also. It is generally covered under two groups: food hypersensitivity and food intolerance. In food hypersensitivity, the symptoms appear suddenly, immediately after ingesting the food item. What are the symptoms which appear in various organs? In skin, there can be rashes or itching. In gastrointestinal system, there can be nausea, vomiting, diarrhea or pain abdomen. In respiratory system, there can be cough, wheeze or difficulty in breathing. Coming to heart and vascular system, there can be palpitations and low blood pressure, and there can be feeling that some impending doom is coming. Now coming to food intolerance. The symptoms of food intolerance are not so sudden. It is rarely dangerous. Common examples of food intolerance, which is very common, these terms are very common nowadays in general public. This is lactose intolerance and gluten insensitivity. There can be intolerance to food preservative also. There can be rashes on body or sometimes blood can appear in the stool. Food allergy can appear after ingestion of any food, but there are certain food which are more commonly involved with the food allergy. These food are milk, eggs, fish, wheat, soya, tree nuts, peanuts, shellfish. Now coming to how we will investigate the condition. Food allergy is investigated by skin prick test. The suspected food item is kept on the skin and then it is pricked by some pin or needle, and after some times the reaction on skin is watched whether there is appearance of any rash or any wheal in the area. There is a blood test called serum IgE level, which is measured after giving that incriminated food items. If it comes out to be elevated, that means the person is allergic to that food. If you are suspecting and you are not sure that at home the child is intolerant to certain food item, give that food in small quantity and gradually go on increasing the dose and see how the body reacts. Before testing the food item in any way, it is important that no anti-allergen should be given before this. Otherwise, the results will not be correct. Now, how we will prevent the food allergy? As I always say in my videos, prevention is always better than cure. All know that we start weaning at the age of 6 months. So we introduce new food items. So every new food item should be introduced after every 4 days only, not before that, because once we have introduced a food item, so we have to check if there is any allergy or intolerance to that food item. Child should be exclusively breastfed for 6 months. That also prevents food allergy in future life. If there is history of some food allergy in close family member, then suppose there is an allergy from peanut to close family member, so that food item should be introduced only after 1 year to the child. After visiting any restaurant, the chef should be called and explained about the food allergy, and he should be warned about using common utensils also. If the child is suffering from any severe food allergy, the parent should always carry a card mentioning the food item from which the child is allergic to. Parents should also carry a syringe and ampoule of epinephrine, and they should learn from the doctor how to use it in emergency situations. Now, how to manage this situation? Best way is to keep child away from the incriminating food items. In any case, if the child develops severe food allergy and if some hospital is nearby, immediately the child should be rushed to the emergency and all the emergency drugs should be given to the child. Very rarely, some children are very lucky and they outgrow their allergy as the age advances. So I have told you everything what I thought I should share about the food allergy. If you think that this video is of use to it, kindly like, share and subscribe, and don't forget to press the bell icon also. Thank you.